Welcome back to Falcon Physician Review's online review for USMLE Step 1. This is Microbiology Module 48, the last module in our microbiology section. We're going to take a second to summarize the trematodes or flukes, and then we'll go through the roundworms or the nematodes. We'll talk about Loa loa, Tracunculus, Milleriasis, Elephantiasis, and other fun diseases most often seen in the Third World. Welcome back to Falcon Physician Review's online review for USMLE Step 1. This is Microbiology Module 48, Pathogenic Helminths, the Trematodes, and Nematodes. Trematodes are nicely summarized in this table. There are also some key features you want to memorize. We have the organism listed in the left column. We talk about how they get to us, the symptoms they cause, how we diagnose them, which is basically all by looking at their eggs, and then the treatment, which is basically all praziquantel. Some things to remember, some things to emphasize include Clonorchis sinensis, which we eat the cysts in the raw fish, causes inflammation of the deformation of the bile ducts. We get hepatitis, anemia, and edema. But also, Clonorchis is a big cause of cholangiocarcinoma. It's a rather rare cancer, and it's unusual for a parasite to cause cancer, but it's important to think about that. Another cancer-causing parasite is Schistosoma hematobium, which is a cause of squamous cell bladder cancer. So if you've got bladder cancer or cholangiocarcinoma, they live in the Third World, you want to think about those. Question. Following a trip from Egypt, a 35-year-old male presents with hematuria. Which of the following is specifically associated with infection with Schistosoma hematobium? Well, this is an appropriately timed question because we just talked about it. What we have here is 4 listed cancers. We've got somebody with hematuria, and so we've got bladder or renal pelvis cancer. We know that squamous cell carcinoma is associated with Schistosoma hematobium, and so don't be confused with adenocarcinoma or transition cell carcinoma. It's squamous cell carcinoma of the bladder. A quick overview of the roundworms or nematodes. They can be intestinal nematodes, like the list shown below. We've got Ancylostoma, Necator, Ascaris, Enterobius, Strongyloides, Trichinella, and Trichuris. If it's a tissue nematode, you've got Brugia, Tracunculus, Loa loa, Onchocerca, Toxocara, and Wuchereria bancrofti. Each of them has their own common name. They have their own way that they cause disease, and we're going to go through them. In general, the nematodes have complete digestive systems, which is different from the cestodes and the trematodes. They have acellular cuticles, and they have distinctive sexes. Transmission is by direct skin penetration for all of these. We could also do ingestion of eggs from contaminated soil. Undercooked pork is a common cause, and insect bites. They can infest almost any tissue. You name it, they can do it. The eyes, the subcutaneous tissue, intestines, livers, and kidneys, they can do it all. The most common nematode infection in the United States is Enterobius, or Enterobiasis. The most problematic worldwide is Ascariasis. Let's talk about Enterobiasis, which is pinworm infection. The causative agent is Enterobius vermicularis. It's a cause of pruritus ani. Basically, you transmit it by ingesting the eggs which hatch in our intestine. The male dies and is excreted in the stool, but the female migrates and deposits eggs in the perianal area. Humans are the only host, and you diagnose it by getting a piece of Scotch tape. You put it near the anus, and you look for eggs on the flattened side of one piece of the tape. You look for white worms as well. Treatment is mebendazole or parental pamoate. Here's a picture of the pinworm microscopically. You can see little clusters of it in the middle figure, and you can see it on intestinal biopsy there on the right. Question. A child is brought to the pediatrician because of perianal itching. Physical exam reveals scaly skin in the perianal region. Scotch tape test shows oval eggs that are flattened along one side. Which microorganism is most likely for the child's symptoms? So little kids with itchy bottoms can have a lot of causes, but if you've got oval eggs on a piece of Scotch tape, that's going to remind you of Enterobius vermicularis, which is C. These other organisms, Ancylostoma, Ascaris, and Necator, are not going to show up with eggs in the perianal area on Scotch tape. Ascariasis, or roundworm disease, is a common worldwide problem. It's caused by Ascaris lumbricoides. It's approximately 1/3 of the world is infected with Ascaris. Transmission is by eating the eggs, and humans are the only host. What we do is in the intestine we get larvae, and they migrate through the blood to our lung. It can cause intestinal obstruction. When the worms multiply enough, they can actually fill up the cavity of our intestine and cause obstruction. We can get Loeffler's eosinophilic pneumonitis. You diagnose it by getting the eggs, which are characteristic in the stool, and you treat it with parental pamoate or mebendazole. Trichuriasis or whipworm disease is caused by Trichuris trichuria. Its asymptomatic or abdominal symptoms include pain, diarrhea, flatulence, and rectal prolapse. You transmit it again by ingesting the eggs. Diagnosis is based on the eggs in the stool. They're often barrel-shaped with clear or mucoid-appearing polar plugs. Treatment is mebendazole. Hookworm disease is different depending on where you live. If you're in the Old World, you have Ancylostoma duodenale, and if you're in the New World, you get Necator americanus. They've graced us with naming the worm after our country. This worm attaches to the mucosa and causes anorexia. It can cause an ulcer, and you get iron deficiency anemia due to blood loss from the intestine. It's transmitted by direct penetration of the skin by the larvae found in the soil. They travel to the lungs, which they can also cause Loeffler's eosinophilic pneumonitis. Then we cough up the worm. Unfortunately, we then swallow the worm, where it matures in our gut and produces eggs. How's that for a life cycle? Diagnosis again depends on the characteristic eggs in the stool and their round or oval rounded ends. Treatment again, mebendazole, parental pamoate. A lot of these hookworms are the same. A lot of these trematodes are treated the same. Threadworm disease is caused by Strongyloides stercoralis. It's uncommon and relatively benign, but it can be fatal if you're immunocompromised, where you get autoinfection. Again, this is transmitted by direct penetration of the skin by the filariform larvae found in the soil. So for Strongyloides and Ancylostoma and Necator, they all penetrate our skin, and we don't eat their worms. We don't eat their eggs. The diagnosis is characteristic of rabitiform larvae in the stool. Again, you can get a Loeffler syndrome, where you get pulmonary symptoms during migration of the filariform larvae. You get urticaria in the buttocks and the waist. Treatment is different for Strongyloides. It's thiabendazole or ivermectin. Autoinfection is where the rabitiform larvae develop into filariform larvae in our intestine. Then, they can invade the intestinal mucosa, travel to the lungs, and reach the intestine that way. Filariform larvae are passed in the stool, and they penetrate the host skin. Trichinella spiralis causes trichinosis. You have an intestinal nematode that insists in the human and porcine hosts. We get it by eating undercooked pork. It causes abdominal pain, diarrhea, myalgia, and eosinophilia. You diagnose this, and it's unique, with a muscle biopsy. In trichinosis, we're not looking at the stool, we're not looking for eggs. We can do serology or muscle biopsy. Treatment is thiabendazole or mebendazole, but only if you catch it early. When it's late stages and they've already encysted, they're not really going to cause any problems, and so we don't treat them. Question. A cattle rancher's wife develops abdominal pain, diarrhea, fever, periorbital edema, eosinophilia, and myalgia. She recalls going to the local cattle fair and having pork sausages. Which of the following techniques would be most helpful for the diagnosis of this patient? So this one, we're thinking of somebody they've been out and they've had an exposure to pork sausages. We have to assume they're undercooked. The eosinophilia tells us they have a parasitic or helminthic infection. And so we think about undercooked pork, you think about trichinella. When you have trichinella, that one is diagnosed. Trichinella is diagnosed without looking at stool for eggs. We do a muscle biopsy. So fortunately, we didn't fall for C or D, we went with B, which is how you diagnose trichinella. Filariasis or elephantiasis is caused by Wuchertia bancrofti or Brugia malai. What happens is you have filarial worms which block the flow of lymph. Therefore, you get edema in your arms, your legs, your scrotum, and that causes elephantiasis. It's transmitted by Anopheles mosquitoes and the Culex mosquito. It's diagnosed by nocturnal blood smears for microfilaria. You can also do PCR for antigen detection. The treatment is diethylcarbamazine or ivermectin. Visceral larval migrans is caused by Toxocara canis, which is the dog roundworm. It's most common in young children. They're playing in the sand, they're playing in the dirt, and they ingest the larvae off their hands. Then it goes to their intestine and matures. Then it migrates to the liver, the brain, and the eyes. Transmission of ingested eggs is from the dog feces found in the playgroup sand. Diagnosis is by biopsy or serology. Treatment is diethylcarbamazine or albendazole. Onchocercus, or onchocercosis, is river blindness, and it's caused by Onchocerca volvulus. We transmit it through the black fly, which is simulin. Onchocerca forms skin and subcutaneous nodules at the site of the bite. The adult worm lives in the cooler subcutaneous tissues in a non-sheathed microfilariae. The Onchocerca causes pruritus, hyperpigmentation because it's in the skin, and ocular river blindness. You diagnose it by biopsy, or you can find the microfilariae in skin biopsy, or you can find the adult worms in nodules. You treat with ivermectin for the microfilaria and suramin for the adults. Question. An Asian 40-year-old immigrant presented with malaise, fever, and rigors, followed by right upper quadrant abdominal pain, vomiting, jaundice, and itching. Infestation with which of the following parasites is most strongly suggested by this patient's presentation? So we have a kind of a generalized disease, but we also have right upper quadrant pain with vomiting, jaundice, and itching. The jaundice and the right upper quadrant pain point us to the liver, and then we think of the liver fluke, which is Clonorchis sinensis. Enterobius vermicularis we know causes anal itching, or anitis. Plasmodium ovale causes malaria, which is going to give us paroxysmal fevers. And Tilia solium is the porkworm, which is going to give us more of a GI system problem. So when you've got jaundice and right upper quadrant pain and we know it's a parasite, think of Clonorchis. Loa loa causes loiasis. We get it by being bit by the deer fly or the mango fly, which acts as the vector. Then it deposits the larvae in our skin, which enter through the wound. They turn into adults, and the female produces sheathed microfilariae during the day. They migrate in the subcutaneous tissue, over the nose, and through the eye. And this picture shows a really gross picture of a worm through the subconjunctival space in an eye. You've got calabar swellings, which is a key catchword to get. You've got itching, and the worm crawls across the eye. It's hard to miss with Loa loa. The treatment is diethylcarbamazine. Dracunculiasis comes from Dracunculosis medinensis. It's the guinea worm disease. You're going to see it mostly in Africa or in Yemen. It's not frequently tested on USMLE Step 1. We get transmission when we drink contaminated water with small infected crustaceans. They die and release their larvae. The larvae become adults in our abdominal cavity. Then the male dies while the female goes to the subcutaneous tissue where it's cooler, and it takes her about a year to get closer towards the skin. The female worm causes blister formation on the skin. The blister ruptures upon contact with water, and then the female releases her larvae where they can be infective to the crustaceans, where we drink them all over again. Dracunculiasis is shown in these pictures where we've got a blister on the skin, expose it to water, and then you can see there's a little worm hanging out, which is really a lot of fun to have. You get allergic symptoms during the release of the microfilariae, and to treat it, you basically get a stick, twist the worm around it, and pull it out 2 to 4 centimeters per day. If that's not the funnest thing in the world, I'm not sure what is. Nematodes are summarized in this table. We have on the left-hand column the organism. We talked about Ascaris lumbricoides, Trichinella spiralis, Enterobius vermicularis, Decatur americanus, and Cyclostoma duodenale, which are the hookworms. It's helpful to know that we treat most of them with mebendazole, and we diagnose most of them by looking at the eggs in the stool. It's important to know where we get them and what symptoms they cause. Finally, the clinical significance. Here's a little summary slide for you for each of the parasites. If you have clinical findings listed in the left-hand column, think of the organism listed in the right-hand column. So if you have brain cysts and seizures, think of cysticercosis with Tinea solium. If you have liver cysts, think of Echinococcus granulosus. If you have B12 deficiency, it's Diphyllobothrium latum. Biliary tract disease is Clonorchis sinensis, also a common cause of cholangiocarcinoma. Hemoptysis is Paragonius westermani, the lung fluke. Portal hypertension, Schistosoma mansomae, and that comes from intestinal obstruction. Hematuria and bladder cancer of the squamous cell variety is Schistosoma hematobium, and microcytic anemia is Ankylostoma necator through blood loss through the small bowel. Perianal pruritus is Enterobius. Let's wrap up Module 48 where we talked about the nematodes or the roundworms. You have 2 summary slides in this module which are golden for you to review. Also, there's a third and final summary slide which is good kind of rapid fire quick memory release right before you start with step 1. It'll help you remember the parasitology. With the roundworms, we talked about a host of different diseases. Most of these are found in the third world. There's usually one question on all of step 1 that encompasses these diseases. If you get river blindness and loa loa, you can think of that. With elephantiasis, you can think of the filariasis. And with the other different nematode infections, you can remember mebendazole. For the most part, that's all you need to know about these rare and unusual diseases. This also concludes our entire microbiology module. You'll remember we started clear back with bacteria. We talked about gram-positives and gram-negatives. We went through all the clinically relevant different species of bacteria that cause human disease. And we did a module on antibiotics. We recognize that bacteria have different processes which we can target them cellularly, and that's the fundamental theory for our antibiotic theory. We use different antibiotics to hit different organisms. Some of them are bactericidal, some of them are bacteriostatic. We then moved on to virology, where we talked about these viruses which encode DNA or RNA. They come into our body and use our host to make their proteins, to make their progeny viruses, and then they either lyse our cells or use our own cell membranes and cell envelopes to go on and cause infection elsewhere in our body and in other people. We talked about the myriad different combinations of viruses depending on whether they're DNA or RNA, how each has to have a replication strategy in order to get the host to get messenger RNA to make viral proteins. Only then can you get assembly of your protein products and you can get progeny viruses ready to bud or lyse the cell. We talked about the clinically important viral families, the hepatitis viruses. We spent a lot of time on HIV, which is frequently asked on step 1. And we talked about the antiviral therapies we have for herpes viruses, for CMV. We talked about Epstein-Barr virus, and some of the human papilloma viruses as well. We then moved on to the mycobacteria, common causes of tuberculosis, which is always on step 1, and also leprosy, which is frequently asked as well. We talked about mycoplasma, a common cause of walking pneumonia. Also, you can get UTIs from ureaplasma ureolyticum. Then we went on and talked about parasites. We talked about the different varieties of fungal infections. You talked about your superficial mycoses, your subcutaneous mycoses, your systemic mycoses like histoplasma, blastomyces, coccidiomycosis, and the paracoccidiomycoses. We talked about different fungal infections that happen in immunocompromised people. We remember that diabetics have mucor infections. Remember that HIV patients get PCP pneumonia, they get aspergillosis, and they get candidiasis. Finally, we talked about the parasites. Parasites are less frequently focused on in step 1. They cause unique, strange diseases. They have unique, strange medicines that we use to treat them. They come in a host of different forms and flavors, and they use different motility to classify them. We talked about roundworms, flatworms, tapeworms. We talked about amoeba. We also talked about Giardia lamblia, which is a common cause of camping diarrhea. Overall, I hope we gave you the flavor of these different world of organisms that can cause human disease. There's lots more out there that we didn't talk about, but it's not going to be focused on in step 1. We've given you the key information you need, the highlights, the lowlights, the important catchphrases you need that you'll see on step 1 in order to get your best score possible. Take the time to review the summary slides included in each lecture. In there you'll find the key information that you need in order to succeed. When you're taking the test, you'll find that if you've studied the material well, these phrases will pop into your mind. You'll have a gut reaction of which bacteria or which virus or which fungus is involved in the question, and you'll be able to find the answer. You'll get the score you want and be able to move on with the options you want after taking step 1. Good luck, study hard, and you'll do well.